PCOS is not the same as having an ovarian cyst. A lot of people confuse the two, but they're actually two very different entities, and I'll explain it briefly. So let's start with what a cyst is. A cyst, anywhere in the body at all, just refers to a fluid-filled sac. That's all a cyst refers to. Now, in polycystic ovary syndrome, there are multiple small cysts within the ovary that classically form what we call a string of pearl appearance. There can be as many as 20 cysts within one ovary, and they each measure between 2 to 9 millimeters, so basically less than a centimeter each. However, when we're talking of an ovarian cyst, it's usually 1 or 2 cysts in an ovary, and the measurement much larger than what we're dealing with when we're talking about PCOS. The other difference is in terms of the symptoms. Now, with PCOS, we have the accompanying symptoms of irregular periods or no periods at all, possibly excessive hair growth from the excessive male hormones, and things like acne, weight gain, and difficulties in getting pregnant. However, with the ovarian cyst, we do not usually have those symptoms. Periods are usually regular if it's a simple ovarian cyst. Also, we shouldn't have any difficulties with getting pregnant if it's just an ovarian cyst. In terms of symptoms, with an ovarian cyst, most times they're asymptomatic. However, if there has been rupture of the cyst, bleeding into the cyst, or twisting of the ovary on that side, then there can be accompanying symptoms like pain, nausea, vomiting, feeling generally unwell, which are not things that you find with polycystic ovary syndrome. The other thing is in terms of treatment. With ovarian cysts, usually you're going to have what we call a cystectomy if surgery is being planned. However, quite a number of simple cysts are just monitored conservatively, which means you have scans from time to time to check on the size of it to make sure it's not growing larger or changing in its nature. While in polycystic ovary, treatment option is completely different because we manage PCOS based on the symptoms that the patient is presenting with. So in terms of regularizing periods, trying to lose weight, fertility treatments for patients who are struggling to get pregnant. So you can see that they're totally different conditions.